Assalamualaikum students, welcome back to the dental hacks. Today the topic of my lecture is the dental instruments. We will study the basic dental instruments that are used in a daily dentistry. Now from the start, this is a mouth mirror. This is a mouth mirror. This is explorer. It has two sides, this one and this one. And this is CPITN probe. Okay, now the uses. The uses of mouth mirror, basically the indirect vision to hold or retract your tongue, lips and cheek like this way. For example, you can retract tongue like this. Tender to percussion. From the back portion of the mirror, we can check the tooth is really fractured or not. From this one, you can check whether the tooth is fractured or not. We will strike the back portion of the mirror to the patient's tooth. If the patient blinks his eye, this means that it is pain. The tooth is painful and it is fractured. Now, this is explorer. It has two sides. Explorer basically is a sickle shaped. It is basically the sickle shaped. This is used to detect the tooth decay. To check bifurcation and furcation. Furcation means branches. To check the caries region, if we apply the probe on the tooth and if it moves smoothly on the surface of the tooth, it means that there is no caries region. Therefore, only the stain we will note cavity preparation and filling. If we apply this portion, this is basically the sickle portion of the explorer. When we apply this portion on the tooth surface, if we are suspicious that whether it is decayed or not, we will apply this portion on the tooth surface, and if it is smooth, then it means there is no carious tooth. There is only the stains that are present on the tooth. Now, this is explorer. It basically have the markings. Its uses are basically used in a clinical assessment of presence or absence of periodontal pockets, calculus or gingival bleeding. CPITN probe, basically there are two types of the CPITN probe. First is a CPITN probe E and CPITN C. E for epidemiological and C for clinical. Now it has different markings. The markings of the CPITN E is 0.5. For example, this black one is 0.5, 0.5, 3.5, 5.5 and 8.5. The probe which has 8.5 marking, it means it is CPITN E, and the probe which has marking till 11.5, then it is a CPITN C. For example, 0.5, 3.5, 5.5, 8.5 and 11.5. And as I told you earlier that it is used for the detection of the periodontal pockets. Now this is a basic dental instruments that we use in our daily life. So again, this is mouth mirror. This is mouth mirror. The front side of the mouth mirror, for example, this one side of mouth mirror is used for the indirect vision, for the retraction of the cheek and tongue. And the back side of the mouth mirror used for the detection of the tooth, whether it is decayed, whether it is fractured or not. When we hit the back side of the mouth mirror on the patient tooth and the patient blink, it means that the tooth is painful or fractured. This is a explorer, and the use of the explorer is that it is used to measure the decayed tooth, calculus, plaque. For example, if we touch the this side, it is sickle shaped mainly. If we touch this side of the explorer on the tooth surface and the surface is smooth, it means there is no cavitation, no decay, only the stains are present on the tooth surface, which occur due to many reasons. And this is a CPITN probe. As I told you that CPITN probe used for the detection of the periodontal pockets. It has a marking 0. There are two types, CPITN E and C. If it has a different marking for the CPITN E, the basically is the 0.5, 3.5, 5.5 and 8.5. And for the CPITN E, for the CPITN C, it is basically the 0.5, 5.5, 3.5, 5.5, 8.5 and 11.5. So this is a basic dental instruments. So if you have any question, you can ask me in the comment section. Tomorrow we will start the basic instrument that is used in a scaling. So if you like this video, please subscribe, like and share my channel. Thank you.